Why do they make these questions so hard? Why? What's up, everybody, and welcome back to PTPioneer, your #1 guide for a career in fitness. My name is Nick, and in today's video, we're going to be discussing the top 10 hardest questions you can expect to see on your ACE Certified Personal Trainer exam. If you haven't already done so, head on over to PTPioneer.com and download our free ACE exam cheat sheet. The link is in the description, and you can also download your copy right up here. Also, be sure to head on over to traineracademy.org and download their premium ACE study materials. These will reduce your study time in half, and they also offer an exam pass guarantee. Now, recent statistics have shown us that you have a better chance of passing your ACE exam if you go ahead and smash that like button, subscribe, and hit that notification bell so you don't miss any videos coming out in the future. The ACE Certified Personal Trainer exam is a comprehensive fitness certification exam that will test your knowledge on the skills needed for success in the fitness industry. The ACE exam includes both scientific knowledge and practical skills that will prepare you to train clients for a variety of health and fitness goals. The following 10 questions represent the scope and wording of the information you should expect to see on your exam. Be sure to understand the underlying topics discussed in the questions, as opposed to memorizing the questions and answers themselves, as the exam you will take will not have identical questions to those presented in today's video. And on an additional note, ACE now offers live, remote, proctored exams, which is an option you should consider if you want to take your test at home. You will be monitored by an individual over Zoom, and you must still abide by all exam policies, including no phone, no scratch paper, no food or drink while taking the test. The live remote proctored option is a good way to avoid all the hassles of driving to your testing location. Just be sure that you have a quiet room to set your computer up in, and that you have notified the rest of your household that you should not be disturbed while taking this exam. With that said, let's break down the 10 hardest questions on the ACE Certified Personal Trainer exam. Question 1. Dan is a new client whom you are meeting with for the first time today. He will most likely be evaluating you as a trainer through both your verbal and nonverbal communication. What stage of the client-trainer relationship are you in with Dan? Is it A, the planning stage, B, the action stage, C, the rapport stage, or D, the investigation stage? The initial consultation with a client is a crucial step in making the sale and helping the individual progress towards their fitness goals. The correct answer in this case is C, the rapport stage. Building rapport is the first of the 4 initial stages of the client-trainer relationship and is key for the long-term success for your client. Proper rapport building involves impressions of professionalism, building trust, demonstrating warmth and genuineness, and exhibiting empathy. Although building rapport is defined as the first stage in the client-trainer relationship, it is in fact an ongoing process that will continue to develop throughout your time spent training that client. The latter 3 stages of the client-trainer relationship are investigation, planning, and action. Each stage depends on building rapport with the client early on to successfully facilitate the later stages. Question 2. Which of these is not a lateral ankle ligament? Is it A, the calcaneofibular ligament, B, the posterior talofibular ligament, C, the medial collateral ligament, or D, the anterior talofibular ligament? The ankle has 3 lateral ligaments and does not include the medial collateral ligament, which is in the knee. Therefore, for this question, the answer is C, the medial collateral ligament. The lateral ankle ligaments are commonly sprained during inversion ankle sprains. To ensure a passing score on the ACE exam, you need to be familiar with the ligaments of the ankle and their relevance when it comes to injury prevention and treatment. Additional knowledge in this domain includes the signs and symptoms of Achilles tendonitis, plantar fasciitis, and patellofemoral pain syndrome. Be sure to study all the conditions from Chapter 15 in terms of injury risk, anatomical structures involved, and treatment protocols. Question 3. What muscle could be hypertonic and would cause an imbalance and associate with a flat back posture? Is it A, rectus abdominis, B, lumbar extensors, C, neck flexors, or D, internal oblique? The postural assessments are key to passing the ACE exam as well as being crucial to your profession as a personal trainer. The static postural assessments can detect the following postural distortions: lordosis and/or kyphosis, flat back, sway back, and scoliosis. In the case of a flat back, the rectus abdominis, upper back extensors, neck extensors, and ankle plantar flexors can all cause this distortion. As such, the correct answer for this question is A, the rectus abdominis. The rectus abdominis is one of the muscles that can cause flat back syndrome when hypertonic. You need to know every hypertonic muscle and inhibited muscle that can lead to each postural distortion. The ACE exam could ask for one or several of the postural distortions and could ask for either hypertonic or inhibited muscles for that distortion. Be sure to carefully review the assessment curriculum from Chapter 7 to be fully prepared for the exam. Question 4. What blood pressure measurement would be a risk factor for cardiovascular disease? Is it A, 120/80, B, 121/81, C, 130/70, or D, 140/90? As a trainer, it's vital that you know the various risk factors for various diseases to be able to assess a client's risk and fully explain the rationale behind that client's exercise program. In the case of cardiovascular disease, the risk factors include the following: age, family history, cigarette smoking, sedentary lifestyle, obesity, hypertension above 140/90, dyslipidemia, and prediabetes. As such, the correct answer for this question is D, a blood pressure of 140/90. The ACE exam places a heavy emphasis on knowing these risk factors, so you can expect to see several questions covering this topic. Question 5. What type of condition does your client likely have if their kneecap swells and they have pain at the front and the inner side of the knee? Is it A, an ACL sprain, B, chondromalacia, C, an MCL sprain, or D, a torn lateral meniscus? Swelling at the kneecap and pain at the front and inner side of the knee are characteristics of answer B, chondromalacia. Chondromalacia is a gradual softening and degeneration of the articular cartilage, usually involving the back surface of the patella. This injury can be caused from overuse, improper training form, or switching too rapidly from a soft to a hard training surface. There are several different knee injuries discussed in the ACE curriculum, including meniscal tears, runner's knee, jumper's knee, and ligament sprains. Each of these injuries has different characteristic symptoms and causes. You must discuss all of the injuries discussed in Chapter 15 and write down the specifics of each injury to avoid confusion on the exam. Question 6. What is the best alignment of the tibia and the trunk when performing a squat? A, an angle of 30 degrees between the tibia and the torso. B, it doesn't matter as long as the knees don't pass the toes. C, the tibia parallel to the torso. Or D, an angle of 90 degrees between the tibia and the torso. When performing a squat, the tibia should be parallel to the torso and the thighs should be parallel to the floor. This gives us the answer of C. When squatting, most injuries associated with improper form occur because of excessive torso forward lean. While clients should be instructed to initiate the movement by hinging the hips backwards, it is normal and safe for the knees to pass the toes, assuming proper overall squat mechanics are being followed. The squat is a foundational movement as both an assessment tool and an exercise. As such, be sure to practice the assessments and movements associated with the squat pattern. Make a list of all the compensations and technique errors, their possible causes in terms of tight or weak muscles, and the associated injury risks for these distortions. Question 7. Which muscle is the agonist during a leg extension exercise? Is it A, the soleus, B, the gluteus maximus, C, the hamstrings, or D, the quadriceps? This question requires you to know the role of agonists, antagonists, and synergist muscles. In this question, the answer is D, as the quadriceps are the agonist or prime movers of this muscle movement. Be sure you understand the mechanics of the exercises covered, as well as which muscle performs each role in an exercise, to ensure you can correctly answer this type of question. Question 8. Which muscles should you aim to strengthen through restorative exercise when a posterior pelvic tilt is demonstrated? Is the answer A, hip flexors and erector spinae, B, gluteus maximus and gluteus medius, C, quadriceps and anterior tibialis, or D, rectus abdominis and hamstring? Restorative exercise is a key component of exercise programming and aims to correct imbalances that occur when certain muscles are tight and other muscles are lengthened. Strengthening the weakened muscles is vital for restoring proper movement. In the case of a posterior pelvic tilt, the suspected tight muscles are the rectus abdominis and the hamstrings, while the lengthened muscles are the hip flexors and the erector spinae. As such, the answer to this question is A, the hip flexors and the erector spinae. You need to be aware of all of the different distortions you may encounter while assessing a client's posture. These include distortions of the foot and ankle, the pelvis, the shoulders, and the neck. You must be able to list the suspected tight and lengthened muscles, and then make appropriate training recommendations. As part of your studying for the ACE exam, as you work through Chapter 7, make a list of all postural distortions and sub-lists of the suspected tight and lengthened muscles, as well as some possible exercises to counteract these patterns. Question 9. In what stage of the trans-theoretical model of behavior change would your client begin to consider the implications of inactivity while remaining sedentary? Is it A, contemplation, B, pre-contemplation, C, action, or D, preparation? The answer to this question is A, contemplation. The contemplation stage is where someone is still sedentary but starts to consider activity. The trans-theoretical model of behavior change is a crucial component when it comes to behavior coaching to improve exercise adherence in your clientele. The trans-theoretical model of behavior change includes the 5 following stages. The first stage is pre-contemplation. In pre-contemplation, individuals are sedentary and are not considering exercising whatsoever. The second phase is contemplation. Individuals in the contemplation stage are still sedentary but have begun to consider the benefits and importance of exercising, making this the correct answer for the practice question. In the third phase, preparation, individuals have begun some activity such as occasional walking and are overall physically and mentally preparing to adopt a more serious exercise program. Phase 4 is action. In the action stage, clients are engaged in regular physical activity but have less than 6 months following their full exercise program. And in stage 5, the maintenance stage, the clients have begun regularly participating in physical activity for more than 6 months. Here, you should refer to your Trainer Academy cheat sheet for the reference of each stage. Be sure you can articulate the specifics of each stage as you prepare for your ACE exam. The stages of change are covered in Chapter 4 and are referenced in later chapters as well. Question number 10. For a client that has hypertension, what is the recommended exercise intensity? Is it A, between 40 and 50% of their VO2 max? B, a rate of perceived exertion between 9 and 13? C, 40 to 60% of VT2? Or D, between 70 and 80% of their max heart rate? This question encompasses both the cardiorespiratory programming and special populations chapters. You may be confused on the different terminology used for measuring the intensity of aerobic exercise. It is important that you understand these different terms and know which measurements are most practical when it comes to programming intensities for cardiorespiratory training. Recall that VO2 max refers to the measurement of the body's ability to use oxygen. While VO2 max is an excellent way to measure the efficiency of the cardiorespiratory system, it is impractical for use in active intensity monitoring due to the equipment required and the risks of vulnerable populations going to maximal intensity. RPE is an acronym for rate of perceived exertion. This is a subjective measure of how hard a client feels they're working. The Borg scale of RPE has a client rate their perceived intensity on a scale of 6 to 20. For hypertensive clients, an RPE of 9 to 13 on the Borg scale is considered the optimal intensity for cardiorespiratory training and is the best way to assign intensities for hypertensive clients. VT2 refers to the point where blood lactate accumulates faster than the body can buffer and remove it. This is also known as the onset of blood lactate accumulation, or OBLA. Exercise at VT2 can typically be sustained for 30 minutes. In practice, VT2 testing is reserved for well-trained athletes and is thus not an appropriate way to assign intensity for hypertensive clients. Maximal heart rate is estimated by subtracting a client's age from 220. While percentages of maximal heart rate can be used to assign intensities, this is not the recommended method for hypertensive clients. Overall, the ACE curriculum spans a wide range of material, from health metrics and general anatomy to movement assessments and behavioral psychology. These questions will not be the exact questions you will encounter on your test, but represent the range of subjects and the wording that you can expect to see on your exam. If you can confidently answer these practice questions, then you are more than ready for your ACE exam. Well guys, we hope you enjoyed this video on the top 10 hardest exam questions on the ACE CPT exam. If you're still looking for additional study materials, head on over to PTPioneer and download the free ACE exam cheat sheet, and then head on over to traineracademy.org and download their premium ACE study materials. Both of these will really help your chances of passing the ACE exam and give you more practice questions like the ones we covered today. If you enjoyed this video on the 10 hardest ACE exam questions, go ahead and hit that like button as well as subscribing and hitting that notification bell so you don't miss any of our videos coming out in the future.